Scott County, providing safe, healthy, and livable communities.
Food support and fraud. Leslie.
Morning, Chairman Wolf. Yes, this is Scott Delivers, and first we'll go around, we'll introduce ourselves, and then Carrie and her team have 5 to 6 minutes to talk about their program and things they want to share with the board, the panel, and the community. I'll kick it off. Leslie Vermillion, the Deputy County Administrator.
Steve Jones, Office of Management and Budget.
Jake Grusing, County Library Director.
Jen Schwartz, Health and Human Services.
Deb Greening, Income Maintenance Supervisor. I supervise the family programs, childcare, and fraud.
Jamie Marshall, Income Maintenance Supervisor for the adults team.
I'm Carrie Wimet, Economic Assistance Director.
With that, Carrie, we'll turn it over to you, and then the panel will get some time to ask questions.
Well, good morning. That fantastic read mobile is going to be a really hard thing to follow. That's so exciting. So glad to finally see it. So we're here today to share some information about our income maintenance programs. Just wanted to note that we do have a third income maintenance supervisor, Jamie Krupa, and she is out on leave, so she's not here with us today. The purpose of our income maintenance program is really to work with our citizens to help them meet their basic needs. This comes in several different forms, one of the forms being cash, which is commonly used to help with housing costs and other household expenses. Food support, which is there to help supplement food costs for the family. Insurance and health insurance rather, and childcare assistance for eligible families. We do know that these services are critical. Without these supports within our community, we would have, our community would be filled with adults and families without affordable housing, safe and affordable housing, without health care, without enough food for themselves or their families, and without safe and affordable child care. In addition to these programs that help our families and our citizens meet their basic needs, the Fraud Prevention Investigation Program is also a part of income maintenance. And within that program, our investigator works alongside those programs to review and investigate suspected cases of program fraud.
All right, and citizens that are in need of assistance can seek it out at any time. They can apply for benefits online, by mail, or in person in the office. Those found eligible will receive their benefits timely. In some cases, it could be the very same day. And if we are unable to meet the needs of the clients, we have lots of resources for referrals, like housing subsidies or housing search assistance. The staff would provide that information to the clients. We can ensure that benefits are issued timely because we take great care to monitor benefit processing and issuance. We adhere to timelines as dictated by specific program policies. We complete regular internal case reviews and participate in state-level audits. And our staff take pride in their work. They understand the importance of what they're doing, how detrimental it would be to families or individuals if they don't receive the benefits.
Some of the highlights that I just wanted to point out, as you've seen through your review of the documents that was provided, our workers issue millions of dollars in food support, cash assistance each year. In fact, since those materials were out, we came up with our December 2017 numbers, and so for the total year of 2017, we issued over $9 million in those benefits. Their benefits are sent directly, most of them directly to the clients through their EBT card. Some of our programs require vendor payments, so some of them were also sent to vendors on behalf of the clients. Additionally, not shown in some of these is that in 2017 we issued over $5.45 million in child care assistance funds to providers. That includes child care centers, licensed home providers, and also some legal non-licensed, or what they call family, friends, and neighbors type of people that do the child care. So without that money, the child care centers wouldn't be able to stay in operation. It supports their businesses, their staff. It provides the money, the funds to pay the licensed legal home providers to allow them to pay their expenses as a household. Not only do we issue benefits, but our fraud prevention investigation program helps us to prevent or recover benefits that were issued to ineligible individuals, which can happen. In fact, in state fiscal year 2017, Scott County saved just under $146,000 and established overpayments of about $225,000 for funds that were issued in error due to fraud.
So that's just kind of a brief overview of our program, so we're ready to open it up for questions.
Jen, Jake, Steve, go first.
Maybe we'll start with the first snapshot on page 5. You had a really big increase from 2016 in your timely processing of applications, almost 9%. I was curious, what do you think worked there that had such an impact for you?
You guys go ahead. Do you have any ideas?
You can go ahead.
We thought one of the possible factors for this is because there was a healthcare unit that was created.
Okay.
So they can really focus on food support and cash, those that worked in those benefits. So another supervisor was also added at that time, so reallocating some of the resources.
Do you think there was any change in the way the measure was calculated at all? Because the other thing is the states improved almost 11% too. I didn't know if there was some change in how it was factored.
Well, I'm not aware of any way.
Yeah, I don't believe so.
Change the measurement.
How does that tie to the one in graph on 7? So that one talks about percent of SNAP expedited applications within 1 business day. That one we've actually declined a little bit since 13. The state's gone up a couple percent since 13, but we're below the state average, where the other we're above on the 30-day. What's the difference there?
There's a number of ways that applications come into the office. They can come in through an online, like Apply 'em In. It's an online application where they can fill those out. Sometimes they drop them off, sometimes they come in the mail. In order to issue those benefits same day, we have to do an interview with the clients, and so if they drop it off or if they file it online, we have the task of trying to reach them to do that interview, and sometimes that doesn't happen in the same day. So we try to reach them by phone. Sometimes they come in, they bring it in, and they wait for somebody to see them, and we can do the interview the same day, and that all works out great. But if they apply online or just drop it and leave, and then we have to make an attempt to get a hold of them, it doesn't always happen the same day.
So how, we can stay on page 7, but you cite that as one of the reasons the expedited processing can be difficult, is that if folks don't have a working phone number or they can't be reached, that's a challenge within a 24-hour time frame. Do you have a sense, other than that happens sometime, I mean, how big of an issue is that? The not having a phone, do you track how frequently that happens with these expedited applications?
We don't track it per se, but do you guys have an estimate for?
There's a number of them that are just dropped off, and there's quite a few that apply online.
Or that we're unable to contact?
Yeah, and some of them don't have a phone at all, so we have to wait for them to contact us. Some of them are working, and it's hard to reach them at work, so there's a number of different reasons, but no, that's not something that we track specifically.
Is the communication that they receive, so when they apply, does it say you'll need to do an interview before we can process your
The packet,
application?
if they come in or they get an application from us, there's a packet that goes with it, and it has all of that on the cover sheet. If they go online, I think it just says contact your agency. And they come through the minutes system is how we get them from online, so. But we make every attempt to contact them, like right away.
So Deb, with a state target almost 20% higher, has the state got any solutions or suggestions, or is there any direction or ideas you guys have for bringing that one up, or thoughts on it?
They also define the state target as kind of the high performance standard, so I will mention that, where if that's kind of like their gold star performance is what their target is. And then there's also, which isn't shown on here, there's a threshold, which is 55%. That isn't, no, that's not a meets expectations threshold. That is the minimum performance that's acceptable before a performance improvement plan would be allowed. So we are well above that, which we're happy to report. But I don't know if you guys want to speak to state strategies that they've shared.
On the most recent report we got, Scott County had the best performance in the 7-county metro area, or had some of the best. The average was anywhere from, let me see, I have that on here, sorry about that. Page 7. Scott County, excuse, yeah, we were at 63.6, and it ranged anywhere from 59.3 to 68.4. So we were right in the middle of the metro counties.
Now, if you do process an application within a day, how long is it before benefits go out to the one requesting it? Is there still like a 2-week period, or?
It kind of depends on whether they've had assistance previously and they already have their EBT card. If they come in the office and we do the application and, and they've never had an EBT card, we can issue one to them right away. If they had a previous card, then we can't issue them one, so then they just wait. If it's approved same day, it goes on overnight. The benefits are on their card. The delay is when we have to do a phone interview because it was online or dropped off and they've never had a card. Then there's the delay in getting the card out to them from the state. But otherwise, if they already have a card, they can be issued overnight.
Which is what you like to see if I followed it, because they're probably in crisis and need immediate assistance, right?
Yeah, if they meet the expedited criteria, they're
Yeah.
in crisis.
Is that tracked, the number of times somebody moves off of that assistance and then comes back on, to be able to see a trend in maybe somebody's life that they're in crisis, they're out of crisis, they're back in crisis? Do you follow any of those trends? Are you able to do that?
That's the only thing we've seen any statistics on is the MFIP, how people are on a really short period of time. In Scott County, they don't stay, there's a 5-year limit for MFIP, and a number of our clients are on for a very short period of time. Some of them come back later, some of them don't.
So MFIP, could you tell us so we all know what that is?
I'm sorry.
Yeah.
Minnesota Family Investment Program.
Okay.
It's a cash program for families. It also has the food support tied in with that program.
Okay.
And Jake, just to add to your point, within the individual record, you can see, of course, there's a trail and a history of all benefits that have been issued, but I'm not aware of any trend reports.
What about page 6? Can we go to 6? I thought this one was... When I took a look at November of 16 at 136, down to 51, that seemed like a significant change. Can you talk a little bit about that and what that means for us?
The difference in the wait list?
Yeah.
Yeah, in November of 17, we were down to 51. We got an increase in our allocation in 2017. It was over $3 million for Scott County, and this is just our basic sliding fee waiting list, so it's not the people who are on any cash assistance. If they're on cash assistance, either DWP or MFIP, that child care money comes from a different pot. So this is strictly an allocation that comes to Scott County for the basic sliding fee program each year.
That had dramatic impact.
Yeah, and one thing I'll add too is, one thing that Deb has shared before is that at the beginning of the year, once we have our new allocation and we kind of have a sense for where we're going to be, we can then release families from the wait list because we kind of know what we're working with at the end. It's a real, Deb can tell you, it's a real difficult thing to manage, this allocation, to ensure that we don't go over obviously we don't want to overspend. So when you get towards the end of the year, you have to be really, really careful with the amount that we're expending and the families that we're releasing from the wait list, because there's so many variables that go into the spending, how big the family is, what kind of provider they're using. So it's a real moving target. And so we often see at the beginning of the year, the numbers decrease if we're able to get a lot more families on, which is great, which is our goal.
The expectation is that we'll spend between 90 and 100% of our allocation during the year. And if we do that, we get whatever's left carries over to the next year. If you spend less than 90, they take whatever's left and divide it out amongst other counties who may be overspent. So our goal is to do between the 90 and 100% of our allocation so that we can get the carryover into the next.
What drove the $3 million increase? Was it you documented need? Or
It wasn't $3 million increase. Our allocation was over $3 million.
It was over $3 million.
Yeah.
So
And they look at the waiting list. They monitor the waiting list at the state level, and sometimes that will increase your allocation.
So the increase in your waiting list during 2016, did that help drive our increase in 17 then?
I believe a little bit, yes. They do look at that. So I think we'll have about 230-some thousand that will carry from 17 over to 18. Because we spent 92.15%.
One thing too is the wait list is monitored and every 6 months, kind of a mass, I don't know if you want to talk a little bit about it, Deb, but like kind of a mass mailing goes out to the families that are on the wait list saying, hey, are you still interested? Can we still reach you here?
What's your current income? We'll send out a questionnaire to them every 6 months and say, do you still need the childcare? What's your current income, to make sure that they're still within the income limits? Has anything changed in your household, number of children, other household members type of thing? And if they return that and they're still within the limits, they stay on the waiting list. If they don't return it, their names are removed.
So sometimes you'll see kind of a dramatic change in the wait list, and that could be as a
When the purge
result
happens.
of that effort.
Thanks, Carrie, I forgot that part.
Are you able to characterize those folks on the waiting list? Are they typically unemployed, or are they working and trying to get by without the daycare assistance, or who?
Most of them are working and
Working.
trying to get by.
Okay.
Yeah. We don't have any, as one of the slides, the waiting list has 5 priorities, and all of the ones that are on the waiting list right now are priority 5, which is your basic citizens, either working, job searching, or going to school. Priority 1, 2, 3s, and 4s, we send those out as they request the apps. 1's being high school GED students. 2 is our transition year, so those are the people that are leaving our MFIP childcare program after a year and moving on to basic sliding fee. 3rd priority is the portability pool, so people who've moved to Scott County on childcare assistance from another county. And priority 4 are the veterans. So we have none under 1, 2, 3, and 4 right now. All of ours are under 5, which is basically everybody else who's not a 1, 2, 3, or 4.
So the basic sliding fee assistance promotes stability for these children, so I understand receiving that while folks are working. And a little bit of attending school, but job searching, and then you mentioned the bottom, the other authorized activities. Are there supports other than sort of monitoring where the money's going? Are there supports to help those people with the job searching, or so that they do become more stable, not just sort of meeting the critical need? I understand that's part of the program, that the kids can be in a safe environment, but then how does it increase, how do we know we're increasing the stability for those parents?
We used to track job search with our basic sliding fee clients. We don't anymore. Policy changed, and we don't do that. But if they're on the MFIP or DWP childcare program, they're working with our employment service counselors also, and so they have that job search and that tracking of activities with them.
Just a general question for you. I tried to do some research before this to see what kind of community indicators could we really look at to see how successful SNAP is. Is there any community indicators that you look at or research to either project what the SNAP needs may be in the near term, and then also how effective is this towards our community, or how does our community really see this program besides the families that are directly receiving the benefits?
One thing that's different between SNAP and our other programs is SNAP is through Department of Agriculture versus Department of Human Services. So sometimes the Farm Bill can affect our benefits and our program regulations. So we watch that closely also. But that's, the other programs all go through Department of Human Services, but SNAP goes through Department of Agriculture. I have not, I guess I don't know that I've seen anything else that would, but they're on different pots of money, so they can be changed that way.
So talk about page 8. You talked a little bit about the overpay savings. This is another one that is dramatically different from 2014 to 2017. Tell us a little bit about that and why the change, or what's different.
Sure. Do you want to take that down?
You can start.
Okay, so there's a couple of things that play into that. The first one being that in 2015, our FPI region went from 5 counties down to 3. So we've...
What's FPI?
Fraud Prevention Investigation, sorry. So this program's region, we had one investigator who was doing all of the investigation for 5 counties. The region moved down to 3, which we think kind of allowed him some more time to spend on the cases that he was investigating, wasn't so stretched. Furthermore, kind of the nature of some of the cases, and Deb, you can speak more to this, but the cases, every case is different. So if we have some larger cases that have risen to a criminal level, there's a larger price tag associated with them. Sometimes if they're clear during a certain year, we're going to see those amounts really escalate.
And those can take a couple, 2-3 years to get through the whole criminal process from start to finish. And we did have a couple of them in, I think it was state fiscal year 2017. We had a couple of those, so that affects that. But yeah, going from 5 counties down to 3 counties, I think was huge. There was a lot of windshield time happening. The 5 counties we had were Scott, Carver, McLeod, Wright, and Meeker. So there was a lot of windshield time happening. And taking a lot of time away from just doing the actual investigations. Meeker and Wright are no longer in our counties, or in our region, so it's just Scott, Carver, and McLeod right now. And even that is a lot of windshield time. That goes all the way out to Hutchinson and Watertown and New Germany, and I mean, there's a lot of time out there. Tom spends 1 day a week in McLeod, so he's there today. And then he also spends time in Carver County each month too, so.
About how many cases are we looking at there with those amounts of money? Maybe I've just missed it in here, but.
In state fiscal year 2017, we had 202 referrals.
202? Wow.
Those are referrals, though, so they're not directly tied to these dollars. I don't know that we might have to
How
get
many
back
are
to
in
you
here?
with that,
Yeah.
like how many
I don't even think
cases
that's in the
resulted in
state's reports.
savings,
They
yeah.
just give us total amounts.
I was just curious, if we're dealing with
Yeah.
5 families or 300 families to be at that amount of money, or?
But I think, and I don't want to misspeak, but there's some statistic like 90% of referrals end up closing without any fraud being found. So it's a very small number that ends up resulting in
Yeah, I'm not sure.
fraud
on that number,
findings.
but there's a number of them there that are not substantiated after all the work that goes into them too, so.
Can you explain one thing on this graph too? The overpay and the savings. Those are not distinct different numbers, correct? That the savings would be part of the overpay, or are they?
They're totally separate.
Okay.
Um,
Okay.
The savings usually come from a case that maybe has applied that never got opened because of what was determined for fraud. So we would take maybe one month's worth of benefits would be from all the different programs, and that would go into the savings category. The overpayments are benefits that were actually issued and then fraud found, and it was so then the benefits were redetermined based on actual information that we had to collect, and overpayments were determined
Okay.
from what was issued versus what should have been issued.
So the savings is benefits we would have given if we wouldn't have stopped it due to
Right.
fraud findings.
And the overpayments are ones that actually were paid.
That were recouped.
Okay.
That have been cited that are
Yeah.
required to be paid back.
So we really did have almost 370,000, or a little more than 370,000 of fraud. Wow.
Is there a waiting list for these cases? So is there more of them coming in than he can get to? And then also, how does he prioritize between the 3 counties?
That's a good question. Yes, there's far more than he can get to.
Okay.
I think some of them are pretty quick and easy. You know, he can go out and he can check something out really quick, and those get done. Some of them take surveillance. The really difficult ones are the non-custodial parents in the household, where he has to do surveillance to determine if, in fact, that the other parent is living there when it's been reported that they're not. So those take a long time. Those are probably the longest amount of time for the surveillance and stuff. And he has to get there at weird hours. You know, he has to go early in the morning to see if they're leaving for work, or he has to go there late at night to see if they're coming home from work, you know, that type of thing. So those are very time consuming. We get reports from the state on unreported income, and some of those referrals come from him. Once a year we get a report from the IRS, like who's had winnings at the casinos. And so, you know, we'll check those out. And so those are some of the ones that are gone criminal. One recently went criminal on that, where he had, you know, hundreds of thousands of dollars in gambling winnings that weren't reported. So we just get our referrals from so many different places that, He tries to prioritize them, and he tries to get them done as quickly as possible. We are lacking in the amount of referrals we get done timely, according to state guidelines. So, but again, I don't know if that's specifically because of the area, 3 counties that he has to cover.
Is there anything we can do as Scott County itself to be more effective up front, rather than waiting till after the fact with him?
I think we're doing everything we can. I mean, the interviews are happening with the workers. They're determining eligibility based on both what's reported to them on the applications as well as the documents that they provide. We have to get a lot of documentation from the clients as far as their check stubs and their bank statements and all of that kind of stuff. So what it ends up being is something that they probably didn't report to us in the first place. And so we don't really have the availability to check a number of different places looking for stuff that might be out there. We have to find out about it later.
In your narrative, you talked, staying on the fraud program, you talked about some minor workload adjustments and freeing up a lead worker. What are you hoping to do with that to maybe have a bigger impact?
We did some caseload switches on the family team, and we took Kayla Flay's caseload away. She's the lead worker of the family team. She's currently training a new worker, but our goal with that change is that Tom can be out there in the field doing as much as he possibly can out there, and Kay will be at her desk and doing the stuff by computer, pulling things that she can from the deed, Department of Economic, area with jobs, and pulling all the different stuff that Tom would also be doing his desk time in addition to his windshield time. So we're hoping that she can help out with a lot of that stuff that needs to be done at the desk, giving Tom more time to go out and do the actual investigations out in the county.
So graph 9, you guys just had ones with numbers changing. I'm assuming the new program or something changed there, right, with METS. And it talked about, if I'm following METS, that's the one where it's parents, adults, children, and then the Maxis is the blind, elderly, those types of folks.
For the most part, yeah.
Which I would have thought would have stayed more consistent. And then the gold one is the one that grew. So can you talk to me about that? Why those changed, or what's going on? If the programs are changing themselves, or that graph a little bit?
I just think that, our population of the individuals who were migrating to METS is much larger than the other population that we're working with. I think, as the years go on, we'll probably see with our aging population, we might see a little bit of an increase there, but just generally speaking, that's just kind of how our, within Scott County, our medical assistance population is divided. I don't know if you...
These numbers that are in the blue over here before METS, that included all the families and stuff also.
Yeah.
So those have shifted. So some of these same ones that were blue are now orange.
Right, and that's what I was kind of curious about. One, the number is obviously grown by almost 5,000, so that to me is a tremendous increase. So
well, that was due to the Affordable Care Act, too.
So there you go.
Yeah.
So
Yep.
Yeah, so sorry. I was thinking dividing the populations, but the Affordable Care Act and the changes to eligibility when that was implemented increased our MA population by, I think it was 84%, I heard at one point in 2014, so.
And so then that's kind of readjusted then over time. Was Maxis still the same then in 2014? That was the blind, elderly, disabled? Or were we still in transition?
We're still in transition
Still
even
in
today.
transition.
Okay, so that's...
It's a gradual thing.
So that's been a kind of a gradual shift and change as you've been aligning the programs better then? That's part of what we're seeing here, Deb?
Yeah, so when the METS system was implemented, it was primarily new applications for medical assistance that were going into METS. So anybody who was on the Maxis system, we've had a slow migration of those cases from the legacy system to the new METS system. And it took about a year to migrate, and we have about 300 cases that are left on Maxis right now that should be on METS that there'll be some sort of cleanup effort this spring. For various reasons, they didn't migrate. So, and then at that point, when the cleanup is done, then the proper populations will be in each system. So I will say, though, that doesn't have any impact to the individuals or families' eligibility. They're still receiving the medical assistance and getting the services they need. It's just a matter of which system we're processing those benefits in.
Now, I was curious on this one that if you process an applicant through the MET system, it shows that you're getting 75% reimbursement, but it seems like the Maxis clients are more of the vulnerable adults. Do you get any reimbursement there, or is that something we pick up the full cost of?
Yeah, the FFP includes both.
Yeah.
So
Oh,
it's,
okay.
yep, so it's a random moments time study. And so the financial workers will get an email and say, you know, what were you doing at this time of day, to really oversimplify it. And if they were determining eligibility for medical assistance, any activity related to eligibility, whether it's in Maxis or METS, that's how that's determined.
Can we go to page 10, please, Deb? On the face of this looks to me like this measure runs counter-cyclical to the economy. So one question is that accurate? Is that assumption accurate? And then, to what degree are you meeting the need? So November 2017, there are 4,500 participants. Do you think that represents 100% of the people in Scott County who should be receiving this, who might be eligible? Or is it 50%? How many folks are maybe eligible for this but not receiving it?
Gosh.
It's a large number.
Yeah,
It
I don't
really
know
is,
that
and I
we
don't
know what
it
percentage
is,
that
but there's
is.
a large number that would be eligible that are not receiving benefits. And they work really hard with the elderly, trying to get them on
With outreach, yeah.
with outreach and stuff, because they don't get a lot, and so they don't necessarily feel it's worth their time to do that, or some of them can't go out and go grocery shopping and, use it, that type of thing. So they work really hard on outreach for the elderly and the disabled to make sure that we can get those on. But there's a significant number that I think would be eligible that are not receiving just because they don't want to apply. But outreach happens, the CAP agency has an outreach grant, so they work closely with us on that.
And SNAP, or I'm sorry, Extension has a SNAP outreach
Thank you.
program too.
Did something change? I mean, I'm kind of with Jake, you look pre-recession, right? You're in the numbers of 2000, and I know the population has increased. It spiked there, and it's come down a little bit, but it's still several thousand higher than it was prior to the recession hitting. Is it more people are aware and they qualify, or changes in eligibility, or?
I don't think there's been changes. Have there been changes in eligibility since then?
During that time, I can't remember the exact year, at one point they got rid of the assets. There was an asset limit, and then assets went away. So there's not an asset limit anymore, but I don't remember what year that happened. I think the influx of, there's been a number of clients that transferred to Scott County from other counties, so they would show up in there. That would maybe explain why it's not decreasing as fast. It's not just totally the economy. And then, you want to touch on the ABODs?
Yeah, so there was a program, well, one of the policies on ABODs, which is able-bodied adults without dependents. We had a waiver from those provisions until 2013.
That sounds right.
And then it got reinstated. So those clients have requirements that they have to follow with employment and training and working to, well, looking for work or looking, to get employment. And if they don't do that within a certain time, they only get 3 months technically of SNAP. Then they would just close. So that could account for some of the decrease in the numbers since
2013, yeah.
Is there outreach we're doing within Health and Human Services, or do you think there's additional things we could do? Because we're serving a lot of the same clients, and so, you mentioned Extension and CAP. Is there things we're doing internally on that?
I know public health does a lot. See here, I can't speak to exactly what they do, but I know that SNAP outreach is a big part of some of their home visiting and some of, kind of woven throughout some of their programs. I'm not sure about other departments, but yeah, I'm sure there's more that we can do to connect.
Yeah, I know that's a challenge for us with so many systems that we don't always know which clients we're working in common.
Right. Oh, yeah. I think we have a lot in common. We just don't know who they are.
I was on page 12, and it's just, this one came up, and it's because of Jake's presentation this morning. I was thinking after I read his presentation this weekend and was reading this. So how are you guys connected with that? You're talking here about the same things, Lisa, Jake, 90% of the brain by 5. Are you guys coordinated in with that in your families now, how we make connections with these other programs, or is there some dialogue taking place?
Not as much as there probably should be. What the Childcare Assistance Program has done for this is put the Parent Aware program in place, where providers who provide certain preschool or school readiness programs in their childcare are able to get an increase in their amount that they can receive. I think it's 20%. You can get up to a 20% increase if they're a Parent Aware provider. And there's anywhere from 1 star to 4 stars, depending just on how much they work on the preschool and that type of stuff with their children. And I think that also affects our budget, because there's quite a few Parent Aware providers out there, which is good. That's great. But they can charge more, and so then seems like we can serve less children than we would if everybody was at the same level, because they're using the Parent Aware things, which, again, that's great, but it affects our budget that way, too. Same number of kids, more money going out type of thing. But I think the state has that connection, but I don't know that we have as much as we should here.
Who monitors the Parent Aware? Is that under licensing?
I believe so. But it's not under my area, so yeah, it must be under.
And Parent Aware, is that both in-home childcare
And centers.
Okay.
Yep, they can.
Available.
There's a few places in town when I drive back and forth between here and the Workforce Center, there's signs up on the houses that they have a Parent Aware childcare in their home.
So when you guys were here, and I think it was, I don't know, a couple years ago, and it might even have been different, one of the things you guys talked about was transportation, and you hear that from your clients. Evening, weekend service, have you guys heard anything? Are you seeing any better coordination there? That was one of, when I went back and looked at what you guys were talking about. Can you talk to us a little bit about that from a big picture?
I don't know if I've heard a lot about it lately. I know that we see it a lot more with the clients that move in from other counties. You know, if they came from Hennepin, they have a transportation system there, and so they come out here looking for lower rent, and they get out here with the expectation that there's also a transportation system that will help them get to work and type things out here. And it's not out here. A number of them end up moving back into the city for the transportation services that are there.
Yeah, and I don't know that we've heard specifically about the changes, but I'm sure they've had a positive impact.
Maybe that's why we're not hearing as much
Yeah,
as we did
exactly. Maybe
before.
we're not hearing as much because it's been really great, so.
Well, I know you guys were one that had talked about evening and weekend, and people can't get back and forth, and childcare issues, and so I was just curious if there had been any discussion, or and if you're seeing any impact on your programs or hearing.
I'm not hearing as much about it, so I guess that's a good thing. I'm sorry. Yeah, I don't have any specifics for you.
Other things, you guys?
When you were talking about what your challenges are, you talked about policy changes from the state and feds, which, I mean, we can only impact, to some degree, and also staff turnover. Are there strategies you're using to try and reduce that as much as possible, or things that are working or not? I know that's kind of a constant struggle.
Staff turnover, yeah. I think we do, we've had a lot of conversations about it and really try to, kind of take a look at onboarding and kind of the lead workers' role in training. We have some really fantastic lead workers, and just kind of, we've had in some units some discussion about what that training program looks like and how can we help the workers feel kind of better supported throughout that process. And so, yeah, it's something that we are constantly working on and talking about.
And we've talked about how some people may see it as like your entry, like you can get in this way, but they may have like case management goals in mind, or kind of the intent to move around. But
When you lose staff, is it more internal, or is it more to other counties, or?
Some of both. Sometimes we feel like a training ground for other counties,
Okay.
but I think it's getting
I'm seeing
better.
a good amount too of individuals just kind of making a little bit of a change in their career too, so.
This job's not for everybody. Oh my gosh. It's very difficult, very difficult.
I think since I've been on the team too, we're trying to be flexible and kind of gear towards the changing wants of employees
Right.
too, so.
I have a policy/political question. One of the big things that's occurring right now that we're aware of is Governor Walker in Wisconsin now is moving forward with putting drug screenings on the SNAP program. And it sounds like it's really to help people advance on for jobs through the program, because it sounds as though drugs is an issue within the program. Is that something that you see at all, and that screening should really be occurring for the benefit of?
No, that's my personal opinion.
Yeah, I don't see it coming for everybody. We do have a screening for those that admit that they're drug felons. We have a random, testing that we do annually with those. There's a question on the application that asks them if they're a drug felon. And so if they admit to it, they do random drug testing with us too, but I don't see them putting it in place for everybody.
As a part of Governor Walker's plan, what happens with the children if someone, tests positive for drugs, then do the children not get the food support?
That's what I don't know.
Or do you put them in foster care, or, where
Yeah,
do they end up?
right.
Yeah, that's a whole thing
That
I hadn't
doesn't
thought
change the
about.
fact that the children need food.
Yeah.
All right, the audience, questions? Claire?
I was just wondering about the data sharing. Is it a problem within the systems? So can you get access to information? And I know like the veterans are very difficult. You probably can't have access to any of their information, is that right? Or can you? Can they share information with you?
Most of the times we have to get a release from the client to be able to get any information, yeah.
We don't have access to their systems at all, but with a release from the client, they're willing to share information with us.
But can you cross-reference within the state system? Because that's a federal system, the veterans would be, but can you do it within the state?
The only thing that would show up in there is if they're receiving veterans benefits, we would have that listed as one of the incomes that they're receiving, but that would be the only way we would have any idea.
All right, Mr. Chairman, we'll turn it over to the board.
Thank you. Commissioner Brecky.
Thank you, Mr. Chair. Thank you for the presentation, and thank you very much for including the program sheets in here that help us understand, how much county dollars are being spent here and how much really we're just passing through from federal and state. I wonder, and this is more for the people at home, if you could just do a quick overview, and I know it'll be very general, but on these 4 types of programs, just to talk about, they are mandated, but to say whether or not they're mandated, give us a little bit of basic info on eligibility. I'm assuming we don't create those eligibility standards. We are subject to those created by somebody else, and just give a little bit more information that way so it would help anybody who's watching at home understand our role, our limited role with these programs.
Carrie, do you want to go first, or Jamie?
Yeah, and Commissioner, are you talking about these
Well,
programs?
I'm really just talking
kind of
about
the breakdown,
cash
versus
assistance,
food?
childcare assistance,
Okay.
food, and health care. Just a quick overview. And I'll just to be blunt, I think we hear a lot from constituents and people, taxpayers, who say we just shouldn't have these programs. And it's not that easy. And I think a little bit of background about why we must, even if we didn't want them, why we must, and then what our role is.
Sure. Where to start?
13.
So, eligibility for the various programs is really going to vary based on a couple of factors, based on family size or household size, and then income. Of course, there's a lot of other factors that are involved, but so it's kind of hard to say specific eligibility factors for each one, so just kind of knowing that plays into it. Childcare assistance, as Deb has kind of spoken to, is divided into a few different programs. One is for the diversionary work program and Minnesota Family Investment Program participants. This is something that as long as a family is deemed eligible for DWP or MFIT benefits, they are entitled to childcare assistance benefits as they participate in those programs, assuming compliance and continued eligibility. The basic sliding fee program that we've spent the majority of the time on, these are for families that are not a part of those programs, and the eligibility for that, again, is based on an income and household size. These are, and then the transition year program, I forgot to mention, sorry, is a part of, it's kind of in between the MFIP and DWP program and basic sliding fees that someone is transitioning off of the public assistance programs and is still eligible for child care assistance.
That funding comes from MFIP and not our BSF
Correct.
allocation.
Yes, and these are programs that we are mandated to offer. Moving on to the fraud prevention investigation program. That's a little bit different, so I don't know if we can skip over that one. Okay, so medical assistance, we are mandated to determine eligibility for medical assistance in our healthcare programs here. Again, eligibility is based on the household size and income. We determine eligibility for medical assistance here, but we do have various households that are within our healthcare population that are considered a mixed household, where we might have some individuals that are receiving medical assistance and then some that are receiving Minnesota Care or other programs that their eligibility is determined by the state of Minnesota. And then moving on to the cash assistance, there are, what might be important to point out is that there are a variety of programs that fall under the cash assistance area. There is, let me see here if I can point to, do we define this on one of our
On
snap
page 1, yeah.
shots? Oh yeah, right here. So diversionary work program, Minnesota Family Investment Program, general assistance, Minnesota Supplemental Aid, Group Residential Housing, Refugee Cash Assistance, and Emergency Assistance, and they each have their own unique eligibility factors. And of course, we are mandated to provide those services, determine eligibility for those. And then our SNAP program, which we've spent a lot of time on today, and we are mandated to provide those services as well. And again, eligibility is based on family size and household income. So I'm sorry, I don't know if that was very helpful because it's so...
I think just to get that out there, and that we don't create those eligibility standards. Those standards are created by other levels of government, and our mandated role is to administer it.
Yes, thank you.
All right, thank you. Commissioner Beer.
Thank you, Mr. Chair. You had mentioned, I don't remember if it was one particular program or all of them, but we had to, I'll use the word spend, 90% or 100%?
Oh, the child care program? The basic
Childcare,
sliding
okay.
fee child care.
So
Yep.
if we do the less than 90, that goes to some counties that spend more?
Yep, it doesn't come back to us or anything. It's because it's a state program that will help or be redistributed to the counties that may be spent over their 100%.
And that was specific to the child care
Yep,
component? Okay.
specifically to the
sliding
basic
fee.
sliding fee child care. Yep.
And then I think this was for the MFIT only. Was that a 5-year horizon, time horizon?
There's a 60-month time limit, yes, on that.
And that's strictly for?
Strictly for MFIP, which is a family cash program.
Okay. And does that timeline change based on life change, marriage, divorce, birth, death?
There's a few categories of extension that can maybe go beyond the 60 months, and that would be needed in the home to care for a disabled child, a few different things like that, working a certain number of hours, but not making enough to still get off the program. There's a couple different categories where they can get it beyond the 60 months, but...
I was trying to make sure my numbers are in the right buckets, so that one's strictly MFIP. So also, as Commissioner Brecht mentioned, or brought out, this is a lot of it's the cans kicked down the road from DC or St. Paul, and we're running with this stuff. which most, every county has the same thing, right?
Yes.
Their state saying, hey, go do this, and counties do it a little bit differently. Is that a fair assessment, how they administer programs or not?
The administration of them is probably
Yeah, I mean,
different
well,
as far
I
as
would,
the way the counties are set up.
yeah, I would say the structure, there's a variety of different kind of staffing structures and ways that clients kind of get in the door and services are provided, but in terms of like, you know, eligibility factors and the process of determining eligibility and what is required and what isn't, that would be standard.
Similar.
Yeah, standard across the state.
So one of my questions, I'm just going to carry on from what Jake had mentioned. So a lot of these graphs are, hey, we saw these people, we got their stuff, you know, the applications were submitted in a timely manner. But what measure do we have as the county that says, hey, people moved into the program, they moved up to the program, they moved off the program? And even though it's administered by the state, is there a way that we can say that, boy, these things work, lives are being transformed, and here's how? Knowing that it's a complex problem. I get that, but is there ways, instead of just saying, hey, we checked the box, and I'm not suggesting that that's the work that's being done, but the measures that maybe the state has that we as a county can say, yeah, we have to do this, we're doing it better than anybody else, and hey, other 86 counties, this is working here. So just measures that show that lives are being changed.
Well, the Department of Human Services has measures associated with the MFIT program that do just that. They follow the families, one of them being the 3-year self-support index, which we talked a little bit about in the employment and training presentation we had. Because our MFIT families not only are receiving the cash and food and childcare assistance benefits through income maintenance, but they're connected with employment and training and working with an employment counselor. So that the Department of Human Services in that program follows families for 3 years after exit and provides data to how many families have stayed off of assistance, how many go off and come back on. So we do have information for that program specifically. I don't have it here today, but
No, and
they
that's
do,
fine.
they do
I just-
look at that. Mhm.
You know, referring back to Jake's fantastic arrows map, you know, there's a lot of different programs that we've even talked about today, but trying to get all of those things to swim in the same direction, give or take, I would imagine would be helpful. Because as I look at that, I think, okay, when you guys go home at night, what measure are you using to say, job well done, we got it done? You know, the goal of these programs collectively are X, and we accomplished. Even though it's a little bit like pushing a rope uphill.
Yep. Well, I think in the short term, so it doesn't speak to your question about kind of long-term individuals staying off of the programs, but in the short term, at least for the income maintenance programs, the timely processing of benefits, we know that these individuals and families are very much in need, so the quicker we can get them the benefits, the better. So being able to know that at least at the front end, we're doing that is really important, and I think the staff does really well in those areas, so.
No, that's fair, I appreciate that. I mean, it's a big deal, so appreciate your hard work in that effort.
Any other questions?
Yes, Mr. Chair. Back to page 8 on the overpayment, what percentage of overpayments, and perhaps our county attorney has some input on this, are actually collected or recovered? Do we have any idea? Like, is it 10%? Is it 90%?
I don't really have an idea on the percentage. There's a number of different ways we go about it. If they remain on assistance, we recoup from their current grant as long as they remain on assistance. I know that collections, goes after them with tax intercepts and different things from their tax returns if they're not on assistance any longer. But as far as the percentage, I'm sorry, I don't know.
Thank you.
Okay. Any other questions? Okay. If not, thank you very much. Okay, moving right along.